Take our free MBLEx practice exams to prepare for your massage therapist certification exam. Question 1. A client is asked to abduct her arms. Which of the following accurately describes her arm movement? She moves her arms away from her trunk. She moves her arms toward her trunk. She rotates her arms at the wrists while holding them toward her feet. She crosses her arms over her abdomen. Abduction means to move away from the midline. Adduction means to add to the midline, or bring it closer. Question 2. Which of the following suffixes indicate a sensitivity to pain? Itis, algesia, listhesis, asthenia. The suffix algesia pertains to a condition in which the client is either very sensitive to pain, hyperalgesia, or has a difficulty perceiving pain, hypalgesia. The prefix asthenia may sound similar, but it pertains to a lack of strength. Question 3. What type of joint would be affected by rotator cuff tendinitis? Synovial joint, fibrous joint, cartilaginous joint, sutures. Synovial joints are characterized by synovial fluid within the joint space. Types of synovial joints include gliding, condyloid, saddle, hinge, ball and socket, and pivot joints. Rotator cuff muscles include supraspinatus, infraspinatus, teres minor and subscapularis. Inflammation of the rotator cuff tendons, tendinitis, would impede the range of motion in the shoulder, which is a ball and socket joint. Question 4. This is an image of a long bone. The arrow is pointing to underscore 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 periosteum, compact bone, spongy bone, epiphyseal line. The arrow points to an area of spongy bone tissue. Spongy bone has numerous open spaces separated and connected by trabeculae. This gives it greater strength and resilience and also decreases the overall weight of the skeleton. Question 5. The kidneys are free-floating organs that are held in place by adipose tissue in the thoracic area. What structure protects the kidneys from harm? Manubrium, true ribs, false ribs, floating ribs. The floating ribs attach on the spine but do not have any sternal attachments. The 11th and 12th floating ribs cover the kidneys to protect it from damage. Question 6. Which of the following muscles attach to the ischial tuberosity? Sartorius, quadriceps, hamstrings, extensor hallucis longus. The ischial tuberosity is the posterior portion of the ramus of the ischium, where body weight is supported. The hamstrings attach to the ischial tuberosity at the proximal end. Question 7. You go outside into cold weather without a coat. Your body reacts to the exposure with goosebumps and shivers. These reactions are all an attempt to return your body to hemostasis, hypothermia, orthostatic hypotension, homeostasis. Homeostasis is the balance or stability internally sought and maintained by the body no matter the external shifts. Hemostasis is the stopping of blood flow. Hypothermia is a dangerous state when the body gets too cold and is not able to produce adequate heat. Orthostatic hypotension is the experience of dizziness or a faint feeling when standing up or coming upright due to low blood pressure. Question 8. A client has a hairline fracture in the left anterior, medial, distal femur. Where is this fracture located? The fracture is at the top of the femur where it connects to the iliac. The fracture is at the bottom of the femur behind the knee. The fracture is at the bottom of the inner femur, on the front of the bone. The fracture is at the top, outer part of the upper arm on the front of the shoulder. The left anterior, medial, distal femur describes the area that is at the bottom of the inner femur, on the front of the bone. Question 9. Which of the following is not one of the organ systems of the body? Integumentary, chakra, urinary, endocrine. The organ systems of the body consist of the respiratory, cardiovascular /circulatory, digestive, immune, lymphatic, skeletal, muscular, nervous, reproductive, renal, integumentary, urinary and endocrine systems. Chakra names the energy wheels of the subtle body system. Question 10. All of the following are anatomical planes of the body except distal plane, transverse plane, sagittal plane, axial plane. A distal plane does not exist. Distal is an anatomical term meaning something away from the center of the body or the point of attachment. The sagittal plane is a plane that divides the body into left and right parts. The transverse plane divides the body into inferior and superior parts. The axial plane is the same as the transverse plane. Question 11. The 5 bone types are long bones, medium bones, short bones, flat bones and round bones. Long bones, short bones, flat bones, round bones and irregular bones. Irregular bones, flat bones, sesamwad bones, long bones and short bones. Irregular bones, regular bones, long bones, short bones, sagittal bones. There are no medium or round bones, and sagittal is a plane dividing the body into left and right sides. Examples: flat bone, sternum; long bone, humerus; short bone, tarsals; irregular bone, vertebrae; sesamwad bone, patella. Question 12. The scapula hosts many attachment sites. The lateral border is the attachment site for the teres major and subscapularis, teres minor and subscapularis, supraspinatus and infraspinatus, teres major and teres minor. The lateral border of the scapula is the attachment site for the teres major and teres minor. The subscapularis attaches at the lesser tubercle and infraspinatus attaches to the anterior aspect of the scapula. Question 13. What muscle assists the prime mover by encouraging the same joint motion while helping to stabilize the moving joint? Antagonist, synergist, fixator, agonist. Synergists help the prime mover, or the agonist, and act on movable joints. An antagonist resists the agonist to move in the opposite direction. The fixator is a type of synergist that holds bones so tension can be used to move the agonist. Question 14. While flexing the little toe, which muscle do we employ? Extensor hallucis brevis, flexor hallucis brevis, flexor digiti minimi brevis, abductor digiti minimi. The flexor digiti minimi brevis flexes the little toe. The extensor hallucis brevis extends the great toe. The flexor hallucis brevis flexes the great toe and the abductor digiti minimi abducts the little toe. Question 15. This set of muscles perform the same actions and are synergists. Pectoralis major and pectoralis minor, gluteus medius and gluteus maximus, supraspinatus and teres minor, latissimus dorsi and teres major. Both latissimus dorsi and teres major perform adduction, extension and medial rotation of the glenohumeral joint. Pectoralis major and minor act on 2 different joints. Question 16. An isolated contraction of which of the following is antagonistic to the action of vastus lateralis? Biceps femoris short head, gracilis, rectus femoris, none of the above. Biceps femoris short head performs flexion at the knee while vastus lateralis performs extension of the knee. Antagonistic action. Note, the explanation in text says extension, but biceps femoris short head is a knee flexor, so it's the antagonist to extension. Question 17. Muscle spindles are most sensitive to what type of stimulus? Slow lengthening, rapid lengthening, alternating shortening and lengthening, sudden shortening. The muscle spindles are proprioceptors that detect muscle length. There is a stretch reflex when the muscle is stretched quickly, rapid lengthening. Question 18. The teres major is called this muscle's little helper as its synergist. Deltoid, latissimus dorsi, pectoralis major, rectus abdominis. Both the teres major and latissimus dorsi adduct, medially rotate and extend the arm. Question 19. When performing a post-isometric relaxation stretch, this is an example of innervating this proprioceptor, Meissner corpuscle, Pacinian corpuscle, Golgi tendon organ, muscle spindle. Golgi tendon organ detects increases in tension of a muscle to prevent injury. Utilizing this reflex allows one to increase a stretch without the muscle resisting it. Question 20. When working with adult clients who are on the autism spectrum, which of the following must be taken into consideration? Lighting and sound levels, touch pressure, communication, all of the above. Many people on the autism spectrum suffer from sensory overload, so the therapist should consider soft music, low lighting, proper pressure, and possible visual communication. Question 21. Olecranon bursitis occurs at which joint in the body? Knee, ankle, hip, elbow. Olecranon bursitis is an inflammation of the bursa at the olecranon process of the proximal aspect of the ulna, elbow. Question 22. A client complains of feeling cranky, being nervous, having frequent headaches, with a tingly feeling in her skin. Of the following, which condition may be causing these symptoms? Anxiety, ADHD, hypoglycemia, hypoglycemia. Hypoglycemia is a condition where a person's blood sugar level goes below normal levels. Symptoms include nervousness, headaches, and tingling skin. Question 23. Which of the following gender and age groups are most susceptible to osteoporosis? Women, ages 25 to 35. Women, ages 50 to 60. Men, ages 25 to 35. Men, ages 50 to 60. Women are at a much higher risk after menopause, ages 50 to 60, when estrogen and progesterone levels drop. Question 24. A client presents with a small bulge at the bottom of his rib cage above his abdomen. What type of hernia does he have? Umbilical hernia, incisional hernia, hiatal hernia, inguinal hernia. A hiatal hernia occurs when the stomach bulges through the diaphragm, rib cage /abdomen area. Question 25. Which of the following is not an effective, safe massage treatment for someone with COPD? Tapotement of the posterior rib cage, myofascial release therapy on the sternocleidomastoid, the scalene and the suboccipitals, lymphatic massage, especially in an advanced COPD, focused neuromuscular release therapy for the latissimus dorsi, serratus anterior, intercostals and pectoralis muscles. MRT on neck muscles is effective for relaxing tension, but it is not necessarily a specific treatment for COPD compared to tapotement, mucus release, or intercostal work. Question 26. A new client's intake form states they have been diagnosed with cataplexy. What does this mean? Pressure buildup behind the eyes, weakness of the joints, temporary muscle weakness, trouble breathing while reclined. Cataplexy is an autoimmune disorder that results in temporary episodes of muscle weakness typically triggered by emotional reactions. Question 27. What hormone is typically reduced during Swedish massage? Dopamine, serotonin, cortisol, oxytocin. During a massage, the parasympathetic nervous system is activated, suppressing the production of cortisol, stress hormone. Question 28. During the repair phase of healing, stretching is a preferred technique. Why? Inflammation is still present. The focus is to break down the scar tissue. Want to allow scar formation, to create a mild inflammation. In the repair phase, the formation of the scar begins. Mild stretching and ROM are indicated to help organize the fibers linearly and allow proper scar formation. Question 29. Massage reduces blood pressure by stimulating which of the following? Parasympathetic nervous system, sympathetic nervous system, muscular system, circulatory system. Massage reduces blood pressure by stimulating the parasympathetic nervous system and getting a relaxation response. Question 30. What is the physiology behind the feeling of well-being brought on by massage attributed to improved immunity, triggering of Golgi tendon organs, heightened postural awareness, release of endorphins? The feelings of well-being result from the release of endorphins stimulated by the safe and caring touch of massage. Question 31. Deep friction massage is indicated in which stage of healing? During the inflammation phase, during the regeneration phase, during the remodeling phase, all of the above. Deep friction massage during the remodeling stage helps form strong mobile scar tissue and break apart adhesions. Question 32. In what section of the SOAP notes would a client's report of lower back pain go? S-O-A-P. S stands for subjective, what your client tells you, like their chief complaint. Question 33. A client slumped forward with the palms of her hands facing the sides of her legs would indicate tight pectoralis major, tight latissimus dorsi, kyphosis, both A and B. If palms face the sides, internal rotation is absent. A slump without rotation indicates a spinal curve issue like kyphosis. Question 34. When a client is holding their breath during deep tissue massage, what is this an indication of? The client is asleep. You are not applying enough pressure. They are relaxing. The pressure is too much. When a client holds their breath, they are not allowing their body to accept the treatment. It's often a sign the pressure is too intense. Question 35. How might pes planus affect the client's body and movements? Positive effects only. Unstable gait and back pain due to collapsed arch, rigid posture and tiptoe walking, difficulty sitting upright. Pes planus, flatfoot, involves a collapsed arch, likely causing an unstable gait and possible chronic back pain. Question 36. What is the best way for an LMT to get an accurate idea of a client's gait? Explain and have them walk back and forth. Have them take an extra lap around waiting room. Gesture for them to lead and observe them along the way. Tasks like high knees in treatment space. The best way to assess gait is to observe the client without them knowing, like on the way to the treatment room. Question 37. A client's demeanor reminds a massage therapist of her beloved uncle. This is an example of countertransference, transference, dual relationship, power differential. When a therapist projects feelings /memories onto their client, it is countertransference. Question 38. Therapists maintain clear standards for client draping to avoid crossing the emotional boundary, social boundary, physical boundary, professional boundary. Draping policies are necessary to avoid crossing physical or sexual boundaries. Question 39. Invoking a right of refusal when massage is contraindicated upholds which principle? Beneficence, non-beneficence, maleficence, non-maleficence. Non-maleficence requires a therapist to refrain from actions that might harm the client, like massaging when contraindicated. Question 40. A therapist feeling bad charging a friend for massage arises from what? Transference, countertransference, dual relationship, power differential. A dual relationship exists when a client is also a friend, making it difficult to maintain professional boundaries like charging fees. Question 41. A massage therapist advising a client to take a certain medication breaks which boundary /rule? Physical boundaries, dual relationship, emotional boundaries, scope of practice. Advising on medication is outside the therapist's trained scope of practice. Question 42. To obtain informed consent, all of the following are necessary, except disclosure, understanding, processing, consent. Processing is not a component of informed consent, which relies on disclosure, understanding, and consent. Question 43. The two main stances for massage therapists to use for technique delivery are straddle and archer, straddle and hunter, squat and lunge, wall sit and lunge. Straddle and archer stances allow the most versatility and efficiency with the least stress on the therapist. Question 44. Avoiding wrinkled clothing and too much makeup is a matter of ethics, scope of practice, professionalism, standard precautions. Professional appearance instills trust and reflects a dedicated office environment. Question 45. Which tax form would an independent contractor receive at year-end? 1099, W2, W4, 1040. As an independent contractor, the therapist receives a 1099 statement. Question 46. All of the following are necessary to legal practice except corporate formation, estate license, insurance, confidentiality maintenance. Therapists don't need to form a corporation, they can work as employees. Question 47. A client may pay for massage therapy services with health insurance, auto insurance, workers' compensation, all of the above. Massage can be covered by health insurance, auto insurance, or workers' comp if prescribed and medically necessary. Question 48. If a client has autonomy in healthcare, it means he or she has ability to pay, self-determination, strong immunity, good reflexes. Autonomy means a person acts with intention and makes their own choices, self-determination. Question 49. Who standardized massage terminology and brought it to the scientific community? Dr. Johann Mesger, John Grosvenor, Dr. George Taylor, Elizabeth Dick. Dr. Johann Mesger is credited with standardizing French terms like effleurage and petrissage. Question 50. Which modality was created originally for pediatric acupuncture? Chuina, Ama, Shiatsu, reflexology. Chuina was originally used to treat pediatric medical conditions as a needle-less option for acupuncture points.